welcome to Whitman Freedom Team. This is our May program in which we're going to be discussing the Mental Health Month and mental health issues, which are very, very important for all of us as individuals and families and communities. In order to introduce our special guest and our expert with regard to mental health, I'm going to turn it over to our founder and executive director, Tom Evans. Tom?
Thanks, Mike. Today we have a really special guest to celebrate this particular month for Mental Health Month. And our special guest today is Dr. Joshua Twomey. And Dr. Twomey graduated with his BA degree in psychology from Stonehill College. Then he got his master's degree from Assumption College in psychology. Mm-hmm. And then he got his PhD from counseling and psychology from the University of Connecticut. Dr. Twomey also is a resident here. He has a wife and 2 children. He's a member of the executive board of the Whitman Freedom Team, and he's going to share his knowledge with us. We've got a series of questions that we'd like to ask him, and we turn it over to you, Josh. The first question. Anything you want to say to start to celebrate the month?
No, thank you really very much for having me. It's an important topic. Look forward to contributing whatever way I can.
Good, thanks.
Josh, as mental health has really kind of become an issue now that people are paying much more attention to. You see it on a regular basis in terms of people who are troubled and face challenges. Is that fair to say? I mean, is there an increase in the number of people who you see and the number of issues that they are facing?
I think a couple things have happened. So I think the answer to that question is yes. I think a couple things have happened. There's been a real, I think, positive push in healthcare to view mental health as equivalent, as important as general physical healthcare. Mental health is healthcare. And there's a lot of work being done among therapists and medical providers to make access to behavioral health similar to access to any other type of specialty field. And that, I think, helps reduce stigma and increases access, which is really important. And then, unfortunately, the pandemic has, over the last several years, has really driven awareness to mental health concerns to the forefront quicker than I think it would have happened naturally. There's some positive about it, coming from a very negative situation, but certainly the pandemic has raised awareness about mental health concerns.
You hear that it's difficult these days for some people to find a therapist or to have the kind of interaction that's necessary in order to provide mental health care. Is that an accurate statement? I mean, I know what you do, and you do a great job, but I presume that there's a strain on the mental health therapy community. Is that fair to say? It
is fair to say. So I think just across the board in healthcare, access to primary care, access to specialty care has been a challenge, especially in recent years. Mental health is not immune to that. So access can be a concern. There's different strategies to help mitigate that, but access to care can be an issue for a lot of folks, especially for kids, and especially for individuals seeking more longer-term or inpatient type of care. That can be a challenge. Yeah.
Josh, you mentioned children. Can you talk about some of the early signs of mental health, not particularly in children, but in the general population? But if you want to highlight children, that would be important.
Certainly.
Thanks.
Yeah, some early warning signs people can experience. Some of them are kind of the standard or perhaps more obvious, just increases in anxiety, increase in depressive thoughts, increase in worry, persistently feeling like you have a problem but not feeling you can generate a solution to that. So we call it sort of cul-de-sac type of thinking, going around and around, but not being able to pull away from that. Withdrawal, certainly. Irritability, is sometimes an underlying symptom of increased anxiety, increased depression, stress, feeling overwhelmed. All of these can be early warning signs. And then there's the more physiological: sleep disturbances, trouble eating too much, physical pain, really body aches, GI concerns, headache, migraine. All of these things could have an underlying psychological root, or at the least an interaction between physiological and psychological. Can all be sort of earlier warning signs of mental health concern. Yeah.
Would early childhood, I'm going to say elementary school in particular, it's probably hard to define that. How important is it for a parent to communicate with the school when when they think the things are not going well, or if they ask how are things going in school, they might be different in two different places?
Sure.
Can you address that?
Yeah, I think your school's guidance counselor, professional school counselor, school psychologist are all available as resources. It's entirely appropriate to bring up concerns you're seeing at home with the counseling department within the school to make them aware, to participate or partake in their services if appropriate, but certainly trying to get as much expertise and input from the professionals in your life is never a bad decision. So.
Just one more comment about that. One of the things that teachers used to bring to attention quite a bit were kids that were drawing in dark black, everything black, or violent kind of things. Your opinion on that? Your take on that?
It's really, really difficult to say this is what that means. That's sort of a projective type of test or assessment. It can mean different things to different kids. In some situations, that can be an early indicator of disturbing thoughts. In others, it could be an interpretation of how they're implementing a certain school assignment. But certainly if there was concerns like that, bringing it up to the school counselor, having that discussion, talking to the teachers. Oftentimes context plays a really, really important role in helping determine what that type of behavior would mean for an individual kid.
Yeah, thanks.
Josh, as a therapist, to what extent do you involve yourself with recommending medication for an individual who's undergoing some kind of mental health stress? Or is talking it out a better way of doing it rather than going to the pharmacy and getting a certain regimen of drugs?
Yeah, certainly. So I'm not a prescriber, so I don't prescribe medication. We'll certainly have conversations with the folks that I'm seeing regarding questions they have related to if they should begin medication or not. It's different for every person. In some cases, it's absolutely essential, absolutely appropriate, and in other cases, it may not be necessary or the best course of action. Some of the things that you want folks to be aware of is, or ensure that they're talking to prescribers about, is interaction with other medications that they're taking, understanding concerns if there's, if a particular medication has addictive properties, to be aware of what are the situations they should be taking this, what are the situations they shouldn't be, how long what is the expectation for how long it takes for the medication to begin working, what should the outcome feel like, what should it look like. I think the most important piece to that is ensuring that whoever their prescriber is that it's part of an overall treatment plan. They understand why the prescriber is prescribing this particular medication or set of medications, how long, what is the anticipation for how long they're going to be on these medications for, and make sure that they're being consistently followed for that interaction. In some cases, medication can make symptoms worse. It's rare, but it absolutely can happen. So being followed by that prescriber is absolutely essential during that type of decision making. Yeah.
How can we de-stigmatize mental health? A lot of people feel guarded in sharing that information with anybody outside the family, or whether it be the school or any other agency that they might want to seek help in. Do you see that a lot?
Certainly.
Yeah?
Yeah, absolutely. I think one of the strongest ways to go about it is internally, the way that we each think about mental health. As I sort of said at the beginning, mental health care is healthcare. Seeing a behavioral health provider really is so much more similar to seeing a cardiologist, a podiatrist, a dermatologist. If you're having struggles in this particular area, seeing a behavioral health clinician is not a personal failure. It doesn't mean you're doing something wrong. It can often mean that there's really, really tough stressors in your life that you're having difficulty managing, difficulty getting a grasp of, and realizing that whether or not you're seeing it from friends, from family, from coworkers, it is far, far, far more prevalent than what we're exposed to. So thinking about it in that way is really, really helpful. And then additionally, I think there has been a lot greater acceptance and openness since the pandemic and how we talk about it. You see it now, which I've never seen in 20 years of being in this field, commercials for therapy services, all of these different type of online teletherapy, hearing that on the radio, television ads. I think it's really, really positive to see it part of the lexicon of general health care.
Josh, there's probably not a town in Massachusetts or even in the United States that hasn't been touched by teen suicide. And you probably see in your practice people coming in talking about, how do I deal with my son or daughter who seems to be under a great deal of stress? Are there any signs that are very, very clear that can help parents who are watching here or just dealing with a teenager?
So I should say I don't specialize in seeing adolescents or kids. I have. It can be really, really difficult to see or to say, here is the definitive set of symptoms that definitely mean this. But certainly things that you want to look out for are social withdrawal, changes in behavior, changes in interest, seeing changes in school and academic performance, pulling away from friends, pulling away from sports, can all be indicators that there is a concern trying to exclude themselves from the support systems that they might have had as something that you can see. But a lot of times it can look really, really silent in terms of what an individual teenager is dealing with, and teasing that out from normal sort of teenagehood. All of these can be symptoms of just sort of normal development too. So I wish I could say here are the definitive set of things, but it can be really, really difficult. But certainly changes in what your kid is presenting is always something to be aware of.
So what role does social media play in this?
Yeah, social media.
TikTok and whatever.
Yeah. It's difficult, right? So we know that social media, for all of its positive aspects, certainly has some really, really serious negative aspects we need to consider. Social media presents, as folks are well aware, presents a world where all of our family and friends are leading optimal, ideal lives, right? We're posting, here's how well my kid did in school, here's their report card, here's they won the soccer tournament, etc. What you're not seeing is, here's the argument our family got into over this last night. People aren't posting that. So seeing those type of images and then comparing it to your own life can just, even subconsciously, can be really, really straining on the psyche, because by our very nature we're always comparing ourselves to everyone else. And then in addition to that, these Facebook and TikTok, they use algorithms that are designed to be addictive. YouTube, they're designed to keep us engaged, to keep us online, to keep us viewing, and then they are tailored to whatever interest the algorithm believes our interest to be.
Target group.
Yeah. And certainly there is evidence over the last couple decades that it has contributed to greater likelihood of mood disorder. Even narcissistic-based thinking has been on the rise. And again, just the overall addictive properties is just something I think we all need to be aware of, especially kids, especially as teenagers navigate, getting their first cell phones or what have you.
Sure.
Yeah.
Yeah, I appreciate you kind of touching on the fact that sometimes it's developmental and so forth, and then sometimes some of the signs that you think could be trouble are overlooked. And I can remember distinctly one of the things that was often commented on was, oh, students' grades will start going down. Well, a lot of the bright ones, to keep the attention away, worked even harder, so you're getting good grades and you weren't quite as concerned. And so that kind of thing is hard to get. And the other part is generational. I'm going to put myself in the older generation. There are some people who think that the way that children are being raised, their grandchildren, they shouldn't this, shouldn't that. Any comment on that? Because I know they told the same thing to me. Don't put your kid in a safety seat, in a car seat. We brought our poor guy home on our lap. Of course, we've learned since then, but initially they come with a lot of resistance to some of these suggestions. You know.
I think that's an excellent point you're making, Tom. You know, in some cases, in order to, I guess, compensate for how they're feeling inside, or the need to feel a level of perfectionism can actually lead to, you know, increased grades or greater performance.
Yeah.
I think that's an excellent comment to point out that there are exceptions to that. You know, I think one of the hardest or the most important pieces is setting a tone that of openness, honesty with your kids, that these issues are things that can be discussed. They can be discussed openly, and that it's okay as a parent to not know the answer to some of these questions. To say, you know what, I don't know the answer to that, but how about we look that up together? How about we figure that out together? Nothing is outside the realm of what we can talk about openly within our household. And to take these struggles seriously. And like you said, some of them can be part of normal development that, you know, most people deal with and then move on from. And that sometimes it can look really, really different. Some people can really struggle with those situations. So yeah, I would say that openness, honesty, and not feeling like a particular topic is outside the realm of what should be discussed in the home is something to really think about. So,
What about bullying these days? Is that a critical ingredient in some cases as well?
Absolutely.
Do you see that in your
Yes.
practice? Yeah.
Yes, I
Among many things I know, but I mean.
And certainly social media has brought about a different dynamic than from when I was going to school. This, you know, to the extent that which, you know, bullying is happening online, really, really difficult to escape. Can be difficult to monitor. To feel like, you know, even when I'm at home, if these things are happening online, some of the safety or the sanctuary that could be sought out in previous years can be more tough to find, and that has an impact.
You talk about conversations with your children as a family and so forth. One of the things that I experienced over the years was conflict between a parent and the spouse of how you should handle things, and that confused the child a lot. Can you speak to that? Do you see that in adults, even like say high school kids and that age group?
Sure. It is a changing world. There are stressors that exist related to what kids are going through, which people are figuring out in real time. Social media just being one of those things. So certainly trying to be on the same page with your spouse in terms of what is important, what are we trying to communicate, what is the underlying message we're trying to express about whatever the topic may be. You know, prior to presenting or talking to the child or the teenager about it directly, really, really important to try to avoid some of those difficult or confusing messages. I think, you know, kids and teenagers, they have questions about things. They are going to seek out answers for wherever they feel most comfortable. And if that's friends, then it's friends. If it's the internet, then it's the internet. So certainly, I think one of the best sources would be the parent, because, you know, how do I make my child feel comfortable to come to me when they have these questions, because they will seek answers out somewhere else. So what do you want the source of that information to be?
Yeah. Josh, without getting into any names or privateness here, if someone comes to your practice, what is your approach? How do you begin the process of trying to get to the bottom of a mental health issue? Is it primarily talking through? I mean, it sounds like a dumb question, but I mean, how do you approach an individual who's dealing with the stress?
Sure. Different therapists have different approaches. I guess the two large buckets would be a non-direct approach and then a very direct approach. I tend to be non-direct and say whatever is the most important thing to talk about is whatever you want to talk about. And that eventually, sooner than later, we'll get to the root of, through that openness and saying nothing is off limits here. And not judging, not trying to say this is valuable to talk about, this is not valuable to talk about, is really, really important to show the person that I'm interested in all that they have to say, and that they're best to determine what the agenda is, and it can change from week to week. Other therapists are different. They're really direct. What is the problem? How are we going to address that today? Here are the steps that we're going to take today. Here are the things that you can do in between sessions. I think what's probably most important is finding a counselor or a therapist that you feel most comfortable with. It is your time and your resources. It is your effort as a client. And that it is of the utmost importance to feel that comfort and to say I can relate to this person. I feel comfortable talking to this person, and I'm getting out of counseling and therapy what I'm putting into it.
One of the things, in terms of mental health providers, there are different kinds. Can you kind of go over the kind of agencies or groups that we have, particularly in our southeastern Mass area?
So it's I wouldn't say it's really kind of regionalized in that way. You know, if someone were to seek out a behavioral health provider, they're going to see a lot of different types of folks. One of the first distinctions is that a psychiatrist, for example, is a physician. They're a medical doctor who are approaching things from a medical perspective, and they're often, not always, but often doing mostly medication management. There are cases where they do therapy, psychotherapy, but not always. And then you sort of have all the other therapist type, psychologists, mental health counselors, clinical social workers, marriage and family therapists. So you see a lot of different licenses if you were to explore and seek out a provider. I think really one of the important things is that regardless of the license, the ability to assess folks, diagnose, and to treat is pretty much all the same, regardless of whatever clinician you're seeing. If they're a licensed clinician, they've been trained in very, very similar modalities and have the same scope of practice, if you want to call it that.
So Josh, what's available in the greater Whitman-Hanson area here where you work, but are there other locations or other services or other people?
Certainly, yeah. There are mental health centers, community-based health centers are available, especially related to crisis and urgent type appointments. A new set of services has become available from Mass Health, for example, called CBHCs. And then sometimes and often a good place to start can be the primary care provider, not to provide the ongoing care, but as a starting point to say to the pediatrician, to say to your provider, is there someone you work with? Is there an agency that you work with that if I call as your patient are going to be able to help to see me a bit sooner? Other folks that you know and trust, for example. So often primary care and pediatricians can be a good source of that. In some cases there are clinicians that work within primary care practices directly, and you can be seen within the same office, for example. Other times you can call your insurance company and see what resources are available in a given area. And then another source that's probably maybe underutilized is just online directories. So Psychology Today, which is a website. Folks can just Google Psychology Today. You just enter in your zip code, and it will pull up a large range of therapists within the South Shore, what they specialize in, what insurances, insurance do they take, what their availability is. Can be a really, really good resource to go to. And then also Massachusetts, in recent years, has launched the Massachusetts Behavioral Health Helpline. You call a general number, you speak to a consultant on the phone, tell them in general what you're looking for, and they will help direct you to services within your area that are currently accepting new patients, and help you decide what is the appropriate level of care, whether it's urgent, non-urgent, inpatient, outpatient. Is a really excellent website that the state is sponsoring.
Yeah.
Yeah.
Now, Josh, where do you work out of now in terms of where is your practice in?
Yep. So I work at Whitman Counseling Center.
Which is where?
It's on Route 18.
Okay.
Across.
I mean, this is not a commercial. I didn't mean it
Yes.
that way. I
Yep.
just want to know if people wanted to speak to you and to others in the area. That's one place to go to. Is that?
Well, it's certainly a place that you can call. It's one of several behavioral health centers in the area you can call. And then I have a small sort of private practice which I see folks in. So, yeah.
Okay.
You know, Josh, your approach, even in talking with us, is really kind of reassuring and soothing, to be honest with you. And I think so often how you approach a person, whether it be a parent of a child or anything, is more important than what you say or what you know. And one of the things that I always felt is that there's a limit to my ability, and when you said go to your child pediatrician or healthcare or whatever it is, that's really a great place to start, because in the 60s and late 60s and early 70s, when ADD and ADHD came along, one of the things that was often battled over was medication. And there was a taboo that you would ever let your neighbor know that your child was on a med or anything. But our advice always was, we don't know, but it looks like a duck, it walks like a duck, it sounds like a duck. It might be a duck. So go to the doctor and let him or her monitor. It's not a drug, it is a medicine. When you misuse it, it becomes a drug. So I like your approach, and I think the fact that people feel comfortable is really probably one of the most important reasons to go to counseling and so forth.
Sure.
Yeah.
Sure. Yeah.
Yeah.
Josh, do you interact with counselors at high schools and middle schools and elementary schools? Well, I mean, is it fair to say that this is something that wasn't there 10, 15 years ago, right? I mean, that there are counselors who deal with that and may refer that student to you. Is that what you often see? Or
Yep. So traditionally, school systems would have more of a guidance guidance counselor model, and then about 20 years ago, a little bit more. There was more of an implementation of professional school counselor, which incorporates guidance counseling, but also incorporates adjustment counseling, seeing kids for clinical reasons, consulting with school psychologists as well. So we've seen an increase in that type of model to work much more on social development of kids, emotional development of kids. And then as a therapist, if I am seeing a kid, it's not rare for me to be asked to go speak during a parent-teacher guidance counselor meeting at a school. It's a very frequent or very normal thing that therapists do. Yeah, to be part of that overall educational team. Yeah.
Josh, can you talk a little bit about the behavioral health helpline that's in Massachusetts, and specifically, how does one approach it? Who can approach it? What are the kinds of reasons you would approach it? What if you speak a different language? How do you get through that kind of thing?
Yeah, so it really doesn't matter what insurance you have. So it's anyone can call in Massachusetts, and really it's a place to go when you just don't know where to go. You just don't know who to call, whether what you're dealing with, or whether you can call if your child's struggling, if a family member's struggling, and you just want to make sure you have a consultant there to help guide you on where to go next if there is if there's concern, if someone's having thoughts of hurting themselves, and you just don't know what the next step is, it's a place to call and speak to a behavioral health consultant on what to do next, where to go next, who can help you. In some cases, if the situation is urgent, if the situation is dangerous, they can send a behavioral health provider to wherever you're at. And just meet you where you are. And other cases, they could say, if you can be 3 miles down the road in 20 minutes, we can help. We can help in person. So it's a place to call and see what are the resources in your area, what do they do, how quickly they can see you, and what is the level of care that is offered by an individual location. Yeah.
Josh, as we go down day by day, week by week, month by month, are you increasingly or decreasingly concerned about the mental health of the people who you come in contact with? Is this a crisis now, as some would use the word, or has it reached that level? I mean, you kind of hear about that as it's a mental health crisis, and now we have Mental Health Month. I don't know if we had Mental Health Month.
Mental Health Awareness Month. Yeah. Nationwide.
Yeah.
Where are we now? Is this a crisis?
I think, it's difficult to say that as a general population, people, experience mental illness more so now as compared to in the past. It's a difficult thing to say. People can report feeling more stressed, more anxious, more depressed. Whether that results in an actual diagnosis or medication management, it's difficult to manage. I think a lot of the crisis is related to access, being able to provide or find providers in a timely manner. And certainly if you're experiencing a major depression, for example, or crippling anxiety and panic attacks, it's very, very disheartening to call a provider and say, well, we can see you in 6 to 8 weeks. Just as if you're experiencing heart condition, with any other part of your body, and say, I can't take this anymore, I need help right now, and to call another type of specialist and say, well, maybe in 2 or 3 months we could see you. That's where a lot of the crisis comes in, is access. And a lot of people, out of desperation, not knowing what to do, go to the emergency room, which can provide, obviously, urgent emergent care, but it's a difficult place to go if you're in a crisis, to go to an already stressed out situation where you don't know, am I going to be here for 5 hours? Am I going to be here for 15 hours? It's not optimal. So I think a lot of it is just access to those services, Joe.
I think maybe the elephant in the room is the word crazy. When people think of mental illness, they, oh yeah, he's crazy. And that gives you a connotation of somebody out of control, or rather than what it really is. And I think some of the people who come out and have spoken against their struggles with whether it's substance abuse or depression or whatever, the baseball player for the Red Sox, Jared Duran in particular, the danger of doing that is that, when you're not feeling great and then you reveal it, and then people pile on, which happen afterwards. Those are so terribly hard to deal with. And the other question I was thinking about, along the same lines, you are in many ways proactive and helpful all the way, and counselors are, and so forth. What happens when somebody suffers something like a suicide of somebody in their family, or some kind of tragedy like that? They blame themselves and so forth. How does that impact the whole family? I imagine.
Yes, massive impact, and probably to a lot of folks, probably indescribable impact in terms of what it can do to a family dynamic, and people can deal with that in very, very different ways. it can be really, really terrible. I think trying to, or seeking out help, seeking out bereavement counseling, grief counseling, to normalize or to acknowledge that what someone is experiencing, as I said before, is not a personal failure because they're struggling. It is a very normal reaction to an often abnormal, intense, overwhelming stressor that people are not asking for within their life, but for whatever reason have received. And having someone to help normalize that, to say everything you're experiencing makes sense. It may not make sense to you. It may not make sense to the people that are most, important to you at the time, and you can be feeling that. But to know that what you're experiencing is normal can make a massive difference in how we go through something like that.
Let me ask you, and you can say it's none of my business here, but to what extent do you bring home the stress that you see every day in your practice? I mean, it must have an impact on you as well. And how do you deal with that?
It can. It certainly can. I think, especially when it comes to kids, it can have a really kind of profound impact. To bring that home, and certainly when I was earlier on in my career, experienced that a great deal. Therapists almost always receive some type of supervision, someone that they can go to, talk to, process, recognize when it's becoming a concern or a problem for the therapist. Is it impacting their ability to do their work optimally? Is really important to behavioral health providers to make sure that we're processing the type of things that we're seeing, or any really type of healthcare provider to ensure that they're processing those type of, but yeah, that does happen. It's normal. Yeah.
Well, it's got to be difficult, I would presume. I mean, just having someone come in who's on the edges of suicide or the like, and seeing you, I mean, I give you a lot of credit, is what I'm saying, to deal with that kind of stress that you see on a regular basis. So I'm impressed. Let's put it that way.
I don't know. It truly is a great privilege to be able to speak to people who trust you enough to tell you things that they haven't told someone else. So it's really a great privilege. It's difficult to hear some of the pain, or a lot of the pain, but it's also what we sign up for, what we agreed to, what we're committed to.
Again, I don't want you to reveal any names or anything else, but have you dealt with some public safety people who have been seeing some tragic things, whether it be an automobile accident or anything that is indescribable in terms of death or anything else? My guess is they need a break. They need some counseling for that.
Certainly.
Have you incurred that?
I have to be honest, I don't think that I have. Like first responder type of situations. I don't have a lot of personal experience as a therapist working with first responders. There are therapists that specialize that type of acute, intense, ongoing, repeating trauma that police officers, EMTs, firefighters are exposed to, is certainly an area that in the realm of trauma, and can lead to it's a burnout, I guess is a lack of a better word. To see that is but yeah, there are therapists that specialize specifically in that type of area. Physicians, ER doctors,
Teachers.
Sure.
It's funny, in the old days, I used to think if they can put a nurse into a building to serve everybody, if they can put a librarian in there, why can't they put a school adjustment counselor who, instead of having to go outside for counseling in the Department of Mental Health, why can't they combine their resources so you don't duplicate and fall over each other to do that? Does that seem impossible?
I don't think it's impossible. I mean, we're really talking about reducing silos of that type of care within institutions. I think healthcare has made a lot of advancement in bringing behavioral health providers to where people go for help, which is primary care. So meet people where they're at. And school systems obviously depends on the particular resources of the school system. How many adjustment counselors they can sponsor, to what degree do the school psychologists offer clinical-based services versus kind of more testing focus. But yeah, I think it can be done. It's but it's often a resourcing issue too.
Josh, when we're dealing with young people, do you find it's mostly a high school problem, a middle school problem, an elementary school problem? All of the above, or
I think it's all of the above. I would shudder to try to say who has a tougher job, an elementary, middle, or high school counselor. I think that the issues that you deal with can look different across the age groups. But yeah, but we do know, based on some recent pandemic-based research, I think that adolescents struggled the most, 13, 14 years old, in terms of overall mental health as compared to some other age groups. But certainly it's difficult to say one versus another.
I'm always of the position that no matter what the situation is, if you're able to get at the basement level and the foundation level and recognize something, and then deal with it, that it lessens the impact later on. And I'd always say, kids who used to quit school at 16, you could quit school. They didn't quit at 16. They quit in 4th or 5th grade after failing or getting these things. And I think sometimes people do think that it's really harder at a high school than it is in an elementary, when you think about little kids who cannot communicate, can't defend what they're saying or explain what they're saying, how frustrating that is. And like you say, none of them are easy. None of them.
Sure.
First of all, I want to thank Josh for being here, but I also want to advise you that you can see this program, which I think is an enormously important one, not only on the local cable channel here, WHCA, but also on YouTube as well. Go to the Whitman Freedom Team. I also want to thank one of our supporters who's always been on the side of education and young people, John Duval from Duval's Pharmacy, as a supporter, and among many others, but certainly John goes out of his way to help what Tom has started here with the Whitman Freedom Team. So with that, Tom, you want to take it away then?
First of all, thank you, Michael. Thank you so much, Dr. Twomey. One of the things that I appreciate about what you gave us was a tremendous balance and a tremendous, the evidence of how much you know and how much you can share with people so easily. And I hope the people out there who are watching this show will take a look at and listen to what you said, and know that there's quite a few resources in this area. No matter how dire things may be, there's always somebody to listen to, and hopefully lend a hand. Thank you so much.
Thank you.
Josh, the Whitman Counseling Center would be one first stop for people who want to be able to deal with an issue, and in our area is what I'm getting at.
I can't say it's a first stop. I think it does depend on what the waiting list is like, for example. So people are prioritized based on when they call, for example, and what type of services they're looking for, and what therapists are available. It's certainly a resource. Certainly, when you can call and discuss with one of the personnel there to see who and what and when type of thing. But certainly it's one of several resourses.
One final thing. I think the schools also are a good resource for helping you to direct where you should go, or where you might want to find that help that you're seeking.
Absolutely.
Again, I want to thank you so much. Excellent.
Great.
Thank you, Josh.
Thank you very much.
We appreciate
Thank
it.
you.
And good luck in all your work. You're doing good. You're doing good work.
I
That's
hope
for
so.
sure.
Thank you very much.
And so with that, I just want to thank everybody for continuing to support the Whitman Freedom Team and the efforts that we're involved in. There's a couple of things coming up. There's a parade, right?
Parade for the Whitman 150th. We'll be in the parade with our shirts on and our banner and our flags.
And Whitman Day too, right?
And Whitman Day will be involved with that. We'll be helping Whitman Day group, the organizers, as well as our own table. But there'll be more things coming as time goes on.
Okay.
Yep.
Anyway, for Tom Evans and Josh Twomey and myself, Mike Kryzanek, I want to thank you for watching. And remember, you can see this program not only on the local cable channel, but also on YouTube. So we'll see you soon next month in June. Talk to you soon.
Peace.